ban on some of the restaurants and most importantly, hair salons. Man, I was really due for a trim, so that's exciting news. But more importantly for us, we are going to be able to go back to seeing patients full time. And we're going to be launching back into that on Monday, May the 4th. And we're excited to see you guys. We've missed you. You guys, our patients are the reason we do what we do. And I don't know about you, but social distancing does not sit well with me. I like seeing my friends, my family, and people. So we're excited to get back into the office. I want to give you guys just a heads up. Even though we're diving back in on May 4th, it's going to be more of a soft launch. We're still watching, reading, listening to all the recommendations that the OSHA and the dental board and everybody's putting out, so that we'll make sure we're doing everything we can to keep us safe. Keep in mind, we established our safety protocols, our PPEs, and all those things back in the days of the HIV virus. At the time it came out, all we knew was if you got it, it was a death sentence, and we weren't sure how it was transmitted, things like that. So we installed a protocol called universal precautions, and so we've adhered to that ever since. And so we've always been above and beyond trying to keep our patients safe, keep ourselves safe, because we have to go home to see our families. So we don't want to take anything home to them. So now that we're staying on top of this, we're going to do everything we can. One of the things that is going to change going forward, at least in the short term till we get through phase 4, I believe, as the president's laid out, is the waiting room is now going to be your car. We have to keep social distancing. We feel like the safest way to do that is when you come in, we're going to communicate via text or phone call, and you'll wait in your car until we come get you or notify you to come in. And so an important note on that is, much like many companies will say, due to extremely high call volumes, phones are going to be hard to get through. So I anticipate that'll be somewhat of a problem, and we don't want to bottleneck everything. So I highly recommend, if you're not using our text number, which is 806-848-4641, again, 806-848-4641, use that to communicate with our front desk. That can save you a lot of headache. And if the phone lines are jammed up, it's a good way to communicate with us. Obviously, we love talking to people, and we're not saying don't call, but if you're having trouble getting through, use that line. That's a good way to get straight through to our front desk. So that'll be one thing. Every time we confirm your appointment, we're going to have to ask those questions, the COVID questions. Have you been exposed? Have you been out of the state? Have you had a fever? Have you had a cough? So I apologize. I know it's a little bit annoying and it's hoops to jump through, but be patient with us. This will pass, but in the short term, we're going to do everything we can to keep us all safe, and that's just some of those things we go through. We'll be checking temperatures on everybody that comes in, again, just as a safety precaution. And so things may look a little bit different. We're going to build in more time to make sure we have adequate time to turn over rooms, disinfect, do the things we're already doing, but we're going to build in extra time. We know traffic getting in and out of the office, it's going to take longer. We're not going to be able to have everybody in the waiting room ready to go. So again, we're just asking our patients for patience. Haha, see what I did there? So be patient with us and kind of just know this is a temporary thing. We're gonna keep up with everything, and once we get flowing and back in the routine of things, our new normal will become normal. So you'll see the girls and myself in the back, maybe wearing extra garb, extra protection. I think we're going over the top, but I'd rather have too much than not enough. I also want to let you know that, again, our protocols, I feel like, are so safe in the back that you would have a higher risk of catching COVID-19 if we pack the waiting room than you would in any operatory, in any procedure. So we treat our families in this environment, and we don't treat you guys any different. So know that we're staying on top of things. There's all kinds of gadgets and gizmos and things that have come out that claim to be antiviral. Some people are diving in and buying these by the boatload. I personally am doing the things we've done that we know science has proven works. And as science backs things up and proves that they're going to help us, we'll start adding more of those measures. But I don't want to buy a bunch of toys and throw them in the trash in 6 months because they didn't do anything. We have extra measures as far as there are things like dental dams, of excavating suction tips and things like that that we'll add and use more often that we've used in the past, but we may be even more diligent using those going forward. So just to let you know, we are starting back up May 4th. We can't wait to see you guys. If you have concerns or questions or just want to know what do you guys do, what are y'all doing to protect me, call us. We'll answer any questions you have. If you have concerns, we want you to feel perfectly comfortable coming back. We wouldn't open if we didn't think it was safe. So I have no fears or concerns. Our staff is ready. We're equipped. We're going to take care of you guys. Again, if you have concerns about just communicating and things like that, the text number, use that. If you want to call back, use that. That's a great way to communicate. And so we're excited. We're ready to get going. We hope that you have stayed safe and stayed well, and we'll continue to. So we'll see you soon.